This lady is a very credible person. Some of y'all ain't gonna be able to follow what she say, but at the end of the day, she gives you the bottom line that we don't know what the hell is coming at us when it comes to COVID or anything else, because this administration don't have trained people in place, and the ones that they are in place, they have no idea what's going on, and they skipping meetings and all kind of shit, allegedly. Do what you will with it.
Good morning. It's Monday, May 26, 2025, and this is your COVID news update. I spent the last couple days reading everything I could get my hands on about NB 1.8.1 and XFG and a couple other variants, so you don't have to. I also took down a prior video about B.1.529 where I was looking at genomic surveillance of incoming travelers to the United States. I got, one thing wrong and about 5 things right on that video, but the one thing wrong is that the sequence is not B.529, B.1.529. That is kind of a catch-all for a poor sequence read. What I did get right is that there is some variants on the increase from travelers coming into the United States, and we weren't sure what they were, and they are different enough that they are capable of creating a SARS-CoV-2 wave this summer. So my advice would be the same around these variants. Make sure you get your updated booster, wear a mask, especially if you are vulnerable, high risk, live or work with anyone who is vulnerable or high risk, and make sure that there is good air circulation in your enclosed indoor spaces where you work. All of these help reduce infection. Another handy tip for helping to reduce infection is actually nasal saline rinses, gargling, etc. This has been shown to reduce infection from person to person, even in the same household. But let's talk about NB.1.8.1 really quickly, XFG, and there are a few others out there. All of them are different enough from our prior JN.1 based vaccines that they will evade some of that vaccine protection. Also, those vaccines, if you haven't gotten your updated booster, the antibody levels that you have likely declined, as they do for other respiratory virus vaccines and respiratory virus infections. So if you've had SARS-CoV-2 in the last 5 to 6 months, you also do not have good antibody protection. What we do have is good memory T and B cell protection, which means if you've gotten a recent booster, you are likely to have less severe disease. SARS-CoV-2 itself can cause immunosuppression, meaning that if you've had a likely recent infection, you may not have as good of a response when you get sick the next time. So across all of my reading and all of the data, what I can say for certain is we are going to have an early SARS-CoV-2 summer wave. It will not be as severe as some of the prior winter waves, but worse probably than last summer's wave and earlier. There is very low visibility into which virus variants are spreading across the world and across the US right now. Right now, NB.1.8.1 accounts for 10% of the WHO sequences across the globe, and it's about 500 sequences that they have. It's been doubling rapidly over the last few weeks. It is more infectious. It is not necessarily more deadly. However, if more people are infected, as we saw with Omicron, which is not necessarily on an individual basis more deadly than Delta, but the higher number of infections can lead to more people dying. We also have extremely low visibility into which variants are spreading across the United States. Human Health and Services has less than 300 sequences per Human Health and Services region, which includes Alaska and Hawaii, and there are 10 total regions. We don't know what's coming for us anymore. In fact, NB.8.1.1.8.1 hasn't even been reported by our CDC yet, and no statements have been made. We have an interim acting head of the CDC who has been reported to be skipping all hands meetings at the CDC. 5 major heads of the CDC have left in recent months, and entire disease tracking programs have been disbanded inside the CDC, as well as vaccine approval meetings and review meetings have been delayed. The data we have showing that NB.1.8.1 has landed in the United States, while it is increasing the hospitalization rates of people in East Asia, come from local health departments and private hospital systems, not our federal government. It is in disarray. People like myself who like to bring you actionable data and science that can help protect your health are going to have to work twice as hard to make sure that we get you the most accurate data possible. But right now, with the low number of sequences and the inability to track things globally and in the United States as well as we were before, all this data comes to you with relatively low confidence per the WHO reports and my inability to actually find any actionable data that is backed by the federal government. It took me hours to put together a report on this and let you know. Long story short, stay the course. Get your booster and watch out because a summer wave is coming. All right, take care out there.